This is Dr. Tiffany Jackson, Naturopathic Doctor at Natural Medicine Now University. Thank you for joining this webinar, Understanding the Thyroid. Thyroid disorders are prevalent in our culture and are unfortunately often poorly understood. Thyroid health is a complex topic, so I have invited Dr. Kurt Woeller to help teach you the function of the thyroid, how it works, understanding lab testing, and specific diets and nutrients that affect its function. So let's get started. Hello, Dr. Woeller. Thank you so much for joining us for our webinar on understanding thyroid health.
Well, thanks so much for having me. It's great to be here.
Great. So let's go ahead and just get started. What is the thyroid gland?
The thyroid gland it's a gland in your neck. And so if people place their thumb and their index finger right at the base of their neck, they may feel kind of like a squishy, little spongy type of gland under their skin. And the thyroid is incredibly important because it is the primary organ responsible for what we call body metabolism. And that is it's generating energy production throughout the body to keep us healthy and happy and keep us active throughout the day. Now, the thyroid, like any organ, isn't there in isolation. It's connected to everything else. In fact, if people go and listen to the webinar that we have done on adrenal health, they'll understand that the adrenals are also connected to every organ system, and the adrenals are connected to the thyroid, and the thyroid is connected to the adrenals. So the body works in unison. Everything is synchronized, and when you have one organ system that's not functioning, it will affect other things as well. And that is the classic case with the thyroid. So that the thyroid gland is incredibly important for our overall health.
What are the functions of the thyroid gland?
The thyroid produces thyroid hormone, and thyroid hormone helps to increase energy production. What I mean by that, by energy production, is our cells produce an energy currency. And that energy currency, these molecules that get produced, are necessary to keep our heart working, keep our digestive system working, keep our brain and nervous system functioning properly, help to regulate our immune system. So everything is linked into that. And it's the thyroid that is one of the primary driving agents behind that. You could kind of think of it like an accelerator in the car. You need a certain amount of gas to get your car to move forward, and it's the thyroid that's helping to drive that mechanism in part. And it does it through the production of thyroid hormones, specifically things called T4 and T3, which we can actually supplement for with medication if we find that the thyroid is deficient.
Great. So can you give us just a little overview of the physiology and a little bit, I guess, too, of, the chemistry that goes on in the brain, and, the brain has to signal the thyroid and what comes out of the thyroid, what's active versus non-active, because later in the webinar, I really want you to explain some of the lab tests that we do. So I really want our Natural Medicine Now listeners to understand, how does the thyroid work?
Well, the brain, think of the brain like it's a filter. So the brain is filtering hormone levels in part. So it has these what are called receptors that can respond if it senses that a thyroid is too high or too low. So let's say, for example, the brain senses that thyroid hormone is too low. It's going to output a chemical that tells a structure in our brain called the pituitary to secrete a chemical called TSH, thyroid stimulating hormone. So the pituitary is outputting TSH to tell our thyroid gland, hey, we need more thyroid. So the thyroid is going to kick out what's called T4. And that T4 is then converted primarily through the liver into what's called T3. And it's the T3 that actually has the physiological activity at the cellular level, where all the energy is being produced, where all the activity is happening to keep our body moving. happens at the cellular level. So the pituitary tells the thyroid we need more thyroid. The thyroid outputs T4. That T4 is converted into T3, and then our cells will respond in kind. Now, when thyroid levels are high enough, the brain will say, hey, we got enough thyroid hormone, and it will turn off that signal to the pituitary to turn off the TSH to keep everything in balance, because we don't want too much thyroid. Excess thyroid can be damaging, can be stressful to the body. It can lead to osteoporosis and heart problems. So we don't want that to happen. So it's a very tight regulation, but it's a very interesting system in how the brain responds to these things and filters out the information that it's picking up on hormones, particularly thyroid hormone, that's circulating in the blood.
So what are some signs and symptoms of people that may be experiencing low thyroid, which would be hypothyroid, or too much thyroid, which is hyperthyroid?
Low thyroid is going to be more common. If people go back and listen to the webinar we did on adrenal fatigue, they'll notice that fatigue and poor sleep and poor sex drive and mental confusion and brain fog and headaches can be, associated with adrenal fatigue. Well, those same kind of things can also happen with thyroid deficit as well. Now, often people, in addition to that, often people who have low thyroid many times will feel cold or chilled, sort of abnormally compared to maybe other people around them. They're always feeling like they need to wear a sweater or a thick shirt. Other people who have low thyroid will often have dry skin or brittle hair or dry hair. That can be more of a severe indication of low thyroid function. Low thyroid can interfere with other hormones. So women can have hormonal irregularities, irregular menstrual cycle, could be a sign of low thyroid function. Again, kind of like adrenal fatigue, poor wound healing, poor immune system can be an indication of low thyroid. So sometimes it's difficult to tease out, is it low thyroid or is it adrenal fatigue? That is the primary issue. That's why I mentioned in the adrenal fatigue talk that when we assess an individual in our practice for low thyroid function, we're also doing adrenal testing, and vice versa. If we're assessing something for adrenal fatigue, we're going to look at thyroid too, because oftentimes they go hand in hand. Now, hyperthyroid or too much thyroid, which isn't as common, but it can occur, can kind of be the other extreme. You'll often have people who have excess thyroid. They're fatigued as well, but it contributes more towards anxiety and stress, sometimes depression, sometimes hyperactivity. In extreme cases, it can lead to psychosis. Elevated heart rate, excess sweating, increased blood pressure, these would be other indications of hyperthyroidism or too much thyroid.
So as a naturopathic doctor, I always see a lot of patients, they come in and, you're doing their history and then you'll say, okay, well, have you had your thyroid assessed? And I always hear, yeah, my doctor said my thyroid's normal. So why are so many patients with thyroid symptoms? They have weight gain, they have sensitivity to cold, they're always tired. How come their regular doctors are always telling them that their labs are normal, their thyroid labs are normal?
Because many years ago, doctors would actually listen to their patients, examine their patients, and they would have a good clinical insight based on their physical examination and based on the clinical presentation of the patient that they were likely having low thyroid issues. And they would use blood testing to help back up that assessment, but they would use their clinical knowledge and experience, despite the lab so much, to still treat individuals who had signs and symptoms of low thyroid and not be solely reliant on a lab test as the sole indicator. Well, that tended to shift over the years. As laboratory technology became more advanced, but unfortunately, when it comes to thyroid assessment, the typical way that the labs are run are really inefficient and not, unfortunately, real helpful. And what I mean by that is because of the complexity of thyroid physiology. You have these different layers, right? You've got the pituitary producing TSH, then you've got the thyroid producing T4, then you have the liver conversion of T4 to T3. What happens today is that doctors only look at one marker. Traditionally, they're only looking at TSH, what the pituitary is telling the thyroid to do. And if it fits within a lab range, they'll say your thyroid looks normal, despite the fact that somebody can have all the signs and symptoms of low thyroid that we just discussed. And so they don't get treatment. And a lot of people go untreated because the TSH value is unfortunately not that accurate. The other problem is the reference range of normal for TSH is really broad. I mean, it's huge. So you'll have a lot of people who will have an underproduction of thyroid, either T4 and or T3, but their body is still kind of putting out normal or semi-normal levels of TSH that fall within the lab reference range, and that's all the doctor pays attention to. Many doctors have lost the diagnostic ability to assess a patient for low thyroid based on the fact that they're so tied to the lab value, and they're not looking at other factors. So what we do is we look at all of the different levels. What really needs to happen is a patient needs to go in minimally and have the TSH, the thyroid stimulating hormone, done. They also need to have their T4 value done and their T3 value done. Now let me take it one step further, because every hormone that we produce is circulating, a portion of it circulates what we call free, which means it's unbound to some other kind of protein. What happens is we have these proteins that carry these hormones throughout the body. And so we have an unbound or a free fraction of that hormone, and then we have a portion of that hormone that is bound to protein. It's the free fraction of a hormone that actually has the active effect at the cell level. And so when it comes to thyroid hormone, it's not just T4, it's free T4. And it's not just T3, but it's the free fraction, the unbound, physiologically active form of the T3 that needs to be measured. So 3 things minimally that people should do: TSH, free T4, and a free T3. That's going to give them a much more accurate representation of thyroid function on a lab test.
Do you recommend people get their thyroid antibodies tested?
Another great question. And this goes into some of the reasons for low thyroid function. Okay? People can have low thyroid, as we discussed in our adrenal fatigue talk, because the adrenals are stressed. And the adrenals get stressed, and one of the things that they do when the adrenals are stressed is they naturally slow down thyroid function to try to conserve energy in the body. So that could be one reason why we run adrenal testing, the salivary adrenal test. Another reason people can have thyroid problems is that the immune system starts to recognize the thyroid as a problem, if you will. It starts to see certain things within the thyroid as maybe being a foreign entity in the body. And anytime the body, or anytime our immune system recognizes something either in our body or something that came into our body from the outside, a bacteria, a virus, whatever, it's going to attack it because it wants to neutralize it and try to get rid of it. There is a certain percentage of people who have either excess thyroid production, so hyperthyroidism, or low thyroid production, hypothyroidism, because of the immune system. And the immune system is attacking the thyroid. And so one of the additional things that we'll do is looking at what you've called thyroid antibodies. Now, antibodies are immune chemicals. They're immune proteins that our body produces, and you can measure these things. So what's called anti-TPO and anti-thyroglobulin antibodies are another level of assessment for thyroid physiology. So those 5 things are part of a comprehensive panel for thyroid assessment: TSH, free T4, free T3, anti-TPO, and anti-thyroglobulin antibody.
Now, are these all tests that regular conventional doctors, the people listening, if they were to go back to their primary care physician or internist, if they have written these lab tests down and they went to go back to their doctor, is the doctor going to openly run these for them, or what should we warn them about?
They are very much available. They're available from any reference lab, any hospital, any clinic. These are very common standard tests. So they just have to request to have these 5 things done. So whether their doctor will do it or not, that's unpredictable. But yeah, these are not some specialty lab. These are all very common and very standard.
Now let's pretend one of our listeners, they've done all this test, and now the doctor has recommended some different kind of thyroid medication for them. I'd just like for you to take a minute and explain the different kinds of medications out there, because I know there's synthetic medications, there's bioidentical forms, and it's very confusing to patients. So if you could just take a minute and discuss the different kinds of medications available, that would be great.
Okay. Most of the medications that a traditional doctor will use are what are called synthetic. So synthetic T4, synthetic T3, or a combination. They might do a combination T4, T3. Most docs will prescribe something called Thyroid, for example, which is synthetic T4. Now, that may be appropriate, and there are people who respond quite well to T4. You have to, when you take T4, what needs to happen, though, is the body needs to be able to convert that T4 into T3. Now, that certainly can happen, and some people, that happens with. There are certain people that have a blockage. It could be a blockage in their liver. It could be a mineral deficiency of selenium, for example, because selenium is needed in the body to convert T4 to T3. So those things need to be in place. And a lot of people get benefit that way, but some people don't. Some people need to take what's called T3. There's a medication called Cytomel, which is a T3, and that's going to give you more of the direct T3 version of thyroid to have that effect at the cell level. Now, some people are real sensitive, and they either don't need T3 or can't tolerate it very well or don't tolerate it in real high doses. There are certain prescription medications where there's a combination of T4 or T3. And the reality is sometimes you don't know how a patient's going to respond until you get them started on a medication and then check back with them, look at their clinical improvement, look at their symptoms, do a physical exam, and sometimes do repeated blood work to see things changes. So it's difficult to say 100%, that one person's going to need this medication versus another. Now, there are also what we call natural thyroid medications. Westroid and Armour Thyroid are common examples. And these are glandulars. These are taken from animals that have a combination of T4 and T3 and what's called other thyroid cofactors. And some people respond very well to those. And the difficulty is that most traditional docs have been trained to use straightforward synthetic hormones. That's not bad, it's just that it's not always necessary for everybody. Whereas more integrative doctors who've done additional training, gone to conferences, did additional studying, may have a preference towards more natural or glandular forms of thyroid medication. Again, it comes down to the individual clinical response. I've had patients that have done beautifully on Armour Thyroid or Westroid. I've had other patients who didn't. We tried Armour Thyroid or Westroid, and they felt better, but they didn't feel, great. We didn't get the total clinical response. And these were people that we had to convert towards a more synthetic version. So it's really very individualized, but there are differences and there are natural options that people can get. So if listeners are on a Synthroid or a Cytomel, and they're just not quite getting the benefit, their numbers are still off on their test, they're still having symptoms of low thyroid, then they should be somebody that can go talk to the doctor and say, hey, let's try a more natural option.
So for our listeners out there who we really like to empower and really teach them to become their own doctors and be familiar and understand their lab work, what would be the ranges if they were to actually look at the copy of their blood work that their doctor ran, for their TSH and free T4 and T3? Can you give us some optimal ranges that our listeners should be looking for their labs to be in?
Yeah, so if they got all three of those, what we like to see is a TSH between 1.5 to 2 would be a nice level. And for the free T4 and the free T3, somewhere in that upper third normal range would be ideal. So those are the areas that they should be looking to see where those numbers fall.
So if they're kind of on the low end of the reference range, then they would want to have their labs retested.
Yes. And, well, specifically, if they're on the low end of free T3, then they need to really consider some type of thyroid replacement.
Can you talk about diet in the thyroid connection and possible gluten sensitivity that's become really popular lately, and just so our listeners really understand what wheat and gluten and how that can really affect the thyroid function?
Well, diet is a critical part of thyroid health, just like it is in adrenal health, just like it is in any other aspect of our body. Iodine, for example. Iodine is important in the thyroid because the thyroid uses iodine to make thyroid hormone. So we need an adequate amount of iodine in our diet in order to have healthy hormone production. Selenium. Selenium is a mineral that, as I mentioned before, is needed for conversion of thyroid, so T4 to T3. And so, selenium deficiency is something that can be assessed if we're not getting good, thyroid conversion. By the way, the way we assess selenium deficiency is through a hair analysis. But overall, various amino acids, tyrosine is an important amino acid that the thyroid uses to make thyroid hormone. So diet plays a key role. Now, just like in adrenal fatigue, and we go back to that discussion, poor blood sugar control, unhealthy fats, excess alcohol, excess junk food is going to rob the body of the nutrients that we need to maintain, healthy glandular function, healthy hormone function. Gluten has a specific effect on thyroid function, specifically with respects to what's called Hashimoto's disease. And this is an autoimmune condition. This is where the immune system is going after the thyroid and causing the thyroid to shut down. So gluten seems to play a role in that function. And there's actually some evidence, too, that in some cases gluten may even be linked to an autoimmune reaction that could cause excess thyroid production. But there's much more evidence to really kind of point to the fact that Hashimoto's autoimmune inducement of low thyroid is strongly correlated with gluten intolerance. So we'll often have people who come back with their thyroid antibodies elevated and their thyroid levels low, get them off of gluten, and that often helps.
Well, I think that was a really wonderful overview. Are there any last comments that you'd like to address about the thyroid?
I think what people need to understand is the thyroid does not exist in isolation. And so they need to have it properly assessed. So they need to do a TSH, free T3, free T4 minimally, add in those thyroid antibodies we mentioned, the anti-TPO and anti-thyroglobulin. If they're not getting good clinical success with the medication that they're on, then they need to talk to the doctor about switching to a different medication, whether they're on natural going to synthetic or synthetic going to natural. The other thing people need to understand is the thyroid is linked very strongly to the adrenals. So please go listen to that adrenal fatigue talk that we had. and consider doing adrenal testing on themselves. And I mentioned in that talk, we have a website called labtestsplus.com where they can do what's called a functional adrenal stress profile. That's a salivary test for adrenal function that we know physiologically is linked to thyroid function. So those would be the main points I'd like to make.
All right, Dr. Woeller. Well, what would be your 3 action plans for our listeners if they really want to get all the information about their thyroid and take action for their thyroid health? What would you recommend?
First off, they need a proper full thyroid assessment. So from a lab test, a TSH, a free T4, a free T3, and since they're doing that, also do the antibodies, the anti-TPO, and the anti-thyroglobulin. Okay, so that's the first action step. Number 2, understanding that diet and lifestyle play a huge role in thyroid health. So mineral supplementation, eating healthy food, healthy fats, proper blood sugar control, proper sleep, cutting down on stress are really key to thyroid health as well. And number 3 is don't solely rely on the fact that just because you're on thyroid medication or that your thyroid tests have been abnormal in the past, that the thyroid is the only player. People should also, for a thorough assessment, get a salivary adrenal test, a salivary cortisol test to look at adrenal function, because the adrenals are linked to the thyroid as well. And if all people do is pay attention to thyroid, they're not getting proper care, proper assessment. So they can listen to the adrenal fatigue talk that we've done to learn more about the adrenal function. But those are 3 critical things that people need to do. All of these tests that we have discussed are available at naturalmedicinenow.com.
Well, that was great. Thank you so much for being here, and you have a good day.
Excellent. Thanks so much. Take care.
Thank you so much for joining this webinar. I hope you now have a better understanding of your thyroid gland and understanding the conditions that are related to thyroid imbalances. I hope you're able to take this information that you've learned and get with your physician to make sure that your thyroid is functioning at its optimal level. So take action and prevent disease. This is Dr. Tiffany Jackson wishing you a happy and healthy day.